Kim, I'm really, really happy that you're here today. The reason I wanted to get together and speak to you is, I guess it's really kind of twofold. Number one, I feel a real, you know, debt of gratitude to you for how you helped me when I had a dizziness situation. And number two is a little more selfish than that. I wind up talking about you and the service that you did for me at least once a month in detail to someone in my network. So I thought, rather than do this every single time I see someone that has an issue, I thought maybe if we record it, then we could I could just refer them to YouTube and say, go look at what Kim and I talked about on YouTube. So that's why I wanted to chat with you today. So,
great. Well, thanks for the opportunity to speak to you.
Yeah, so maybe what I'll do is just explain a little bit about the situation I had, and then ask you, how you diagnosed it and what we did, and just so we get that part out of the way right away.
Yeah, sure.
So back in, I guess the summer of 2018, I had a health issue, and, most of the people that looked at it thought it was a mini stroke, or a TI as they refer to it. And the outcome of that was I had real balance issues when I finished all the diagnosis and everything. And I had a lot of trouble walking. So I got out of the hospital, I couldn't go up and down a set of stairs, I couldn't walk the length of the street. And then because you were next door to us, I'd seen your sign all the time. I kind of looked and said, NL Balance and Dizzy, like, it's kind of a quirky name. I wonder what it is. And the neurologist that had treated me said, absolutely, go in and see Kim, and I'm sure she can help you. And I showed up inside your clinic, and I told you the issues I was having, and then you took over from there.
Yeah. Brian, dizziness is a symptom of many different conditions, and because of that, it's really hard to get a diagnosis. And if you look on their website, Vestibular Disorders Association, sometimes they say it takes about 3 years before people can actually get their dizziness diagnosed and what's causing it. So like you were feeling, you kind of feel lost and don't know what to do and what's causing it. And it's a lot of people live with dizziness without really knowing what's causing it. And they go through a lot of physicians, a lot of appointments, a lot of scans, because they need to rule out, is it a heart issue, is it a brain issue? And finally, once they get to a diagnosis, then people can get some treatment. I'm a physiotherapist who specializes in helping people with dizziness and balance issues. And in Newfoundland, there was no balance and dizziness clinic when I came back here in 2008. And a lot of people were suffering with dizziness, and they didn't need to because there's therapy for it now. So dizziness can be caused by a number of different things. The people I tend to help are those that have dizziness because of an inner ear problem or a concussion. And believe it or not, your balance is controlled by your vision, your inner ear, and your muscles and joints. It's kind of like there are 3 data sensors that send information to the brain. So your inner ear tells your body where your head is in space. Your eyes tell you where your vision is, where your level, what angle your head is at. And then your muscles and joints kind of tell your brain what position they're in. So those 3 sensors send that information to your brain. Your brain processes it, and the brain tells your eyes, your neck, and your body what to do so you can balance. So it's quite an important function that our brain has to help us balance. And you don't realize it's a problem until you try and do something with your eyes closed, walk in the dark, stand on one foot, bend over. So when I moved back to Newfoundland, there was no one really around that had some skills to help people with dizziness. So there's a lot of balance and dizziness centers in the United States and in Nova Scotia. So when I came back, I thought, maybe I can make a living helping people get rid of their dizziness and help them with their balance. And
you're the only one in Newfoundland, aren't you?
Well, there's all kinds of physiotherapists, but within physiotherapy, you can specialize. And when I went to the States, I got exposed to some advanced technology and some expertise about helping people with dizziness. So when I came back to Newfoundland, I think I'd probably been the only therapist that had 10 years experience working with people with dizziness. And I knocked on the ENT's door and said, you know, can I come and help your dizziness patients? And they said, well, there's nobody here doing that. So that's how it started out for me.
Well, it's really funny because after I explained to you my situation, you know, within 5 minutes you had me in the patient room and you brought out what I thought was swim goggles and you put on me. I thought, oh my God, what is this? Why am I putting on a swimmer's mask? And, you know, very, very quickly you went through it. You kind of explained to me what we were going to look for when you played it back for me on the computer. I mean, I'd never seen anything like that before. No one had ever mentioned anything like that before, but that's the first thing you did for me.
Yep. So the technology is really exciting right now in vestibular rehab and imbalance and dizziness assessment and diagnosis. So I was lucky when I was in the States that I was exposed to that technology. So at the Balance and Dizziness Clinic that I visited when I lived there, they had that technology. And then when I came back to Newfoundland, nobody had that technology. And we had learned how to do certain diagnostic tests without that technology. But when I said I'm going to open up the Balance and Dizziness Center, I thought, well, I might as well have that technology. So it's just a glorified snorkel mask, and it has an infrared camera over the eye, and the eyes are a window to the ears. So if there's something wrong with your inner ear, your eye can move a certain way. So the infrared goggle videotapes any abnormal eye movement that can occur if your ears have a problem with them, or your brain. So people try them on and think it's kind of weird. But when you actually play back the video and you can show people the movement of the eyes, it's really, you get credibility. Because if you're dizzy, nobody can see that. And you kind of live with that. Nobody, it's not like a broken arm. People see a cast, you know, what happened to you. If you're dizzy, you live with that. And it's really hard to explain to people what it's like to live being dizzy and to be off balance. So when you actually have someone who can show you concrete evidence of the injury or the problem that you have, it's kind of, you get credibility, and now you realize that there's hope and there is a problem and there's something I can do about it.
Well, it's funny, when we went through that, there's two things that occurred to me. You explained to me that one eye movement would be, you know, indicative of inner ear. Another eye movement would be indicative of a brain/stroke problem. And you asked me to decide which way my eyes were moving, and then you explained to me, and you know, so all of a sudden, then you gave me confidence that I didn't have a stroke, but I knew I had real serious balance problems. And I started, you know, once you started giving me exercise, I started going back to the gym because I could get into a corner there and stand on a Bosu ball or whatever. But if you saw me walking down to the gym at 9 o'clock in the morning, I was wobbly when I was walking. Sometimes I'd have a staggered step. Sometimes I'd hit the building. And if someone saw me, they'd look and say, either he's got a, you know, health issue, or he's been in the bar too long last night. And it was like, it was really awkward because nobody really knows why you're walking like that except you. So I really get that portion of it.
Well, you were really keen too. You wanted to know what was wrong with you and what you could do. You were very proactive with managing your health. Not everybody has that skill. And you asked a lot of questions, and you wanted to know what to do to help yourself. But people who are dizzy and off balance are very embarrassed. They don't want to tell anybody because people might think they're drunk. They will become socially isolated because they don't want to go outside because they're afraid they might fall. So it's an awful condition to be living with. And the thing with dizziness now, dizziness is a symptom. It's like if you say, I have pain, it's a symptom. So someone needs to tell you what is the cause of your dizziness. It's not just because you're getting old. It's not just because you're anxious, because dizziness is a symptom of anxiety too. So a lot of times when you came in to see me, Brian, I see people in that quiet room with all that technology all day long. And I go through a box of tissues a week, because finally someone gets to talk to somebody who recognizes their symptoms, can help them understand why they're feeling that way, and can give them some hope and education around what the problem is and what they can do to help themselves. And it's funny, I read Melinda Gates' book. It says The Moment of Lift, where they were talking about the girls who finally got confidence to lift their head.
Right.
And in my clinic, I get the moment of hope, right? Because all of a sudden, someone will look at me and you'll see that look come over their eyes. Like, what do you mean I don't have to live with this the rest of my life? What do you mean this is actually a problem? It's not in my head. I'm not imagining it. And you mean to tell me there's something I can do to help myself get better? So
And I understand
it's a
that
big
because,
deal.
you know, I saw all kinds of different, you know, medical practitioners, and it wasn't getting any better. So I was getting more frustrated, and it just, you start to, like you say, you start to lose hope. And I didn't want to go out because people would have thought I was drunk. I didn't go up and down stairs anymore because I didn't have the confidence that I could do it, you know, and certainly not comfortably. So those are some of the things that bothered me. One of the things I want to ask you, though, is that, so my dizziness was a result of, you know, an incident on the job site one day. It just happened to me. But lots of the friends of mine that I've talked to, you know, they didn't have that same incident, but they still have these issues of dizziness and, you know, balance issues and maybe blurred vision and stuff like that. Is there anything that you can kind of identify as early warning symptoms of a balance or dizziness problem that people could kind of start looking and thinking about and say, oh yeah, I have that. Maybe I should check into it?
That is a great question, and my answer to that would be yes. If you have trouble reading, if you find you can't walk in Walmart, if you're walking with your spouse and your spouse keeps saying, you're walking in front of me, like you're veering to the side, if you have any symptoms in your inner ear, those are kind of things that you want to talk to your doctor about and go and get a balance or dizziness assessment.
What would an inner ear issue be like? Like, I don't know.
Yeah.
Even though I know I've had one, but I think it was driven by that one incident. So what type of incident would I be looking for or condition?
So dizziness is a symptom of many inner ear type conditions. So if I just gave you a few examples, sometimes you'll hear people say, I have vertigo.
Right.
And they'll say, if I go to the dentist, I can't lie back in the chair. Or if they go to the hairdresser, they'll say, I can't lie back in the hairdresser's chair. Because if they lie flat, they'll get dizzy. And that's typically a symptom of benign positional vertigo. Now, I don't know if you've ever heard people say the crystals are out in my ear.
Yeah,
You hear that?
all
People
the time.
hear that, right? So that's an inner ear condition where there's a mechanical displacement of these crystals that sit in part of your inner ear that are there to help us orient ourselves in space. So occasionally, with a fall, a bang, a knock to the head, you can actually knock out your crystals.
Right.
So they come out of the
That's where
sac.
you smack me in the head
Exactly.
and get it back,
Yeah,
right?
yeah. That's the Epley maneuver.
Yeah.
So you can knock out your crystals. So it's like a snow globe. If you turn a snow globe upside down, the snow floats.
Right.
In your inner ear, if the snow is not stuck in the jelly where they're supposed to be, if you roll over in bed, you bend down to put on your shoes, look up in the closet, and you get this momentary sense of dizziness, that might be a symptom of benign positional vertigo. And that's something you want to go see your doctor, get diagnosed, or come see a physiotherapist who treats that. Because that is a quick fix. You literally take the head, roll it in a certain way, and put the displaced crystals back in place. And that's 1 to 2 treatments, and that's a curable form of dizziness.
Yeah, but you and I actually did that after I went through the rehab program that you designed for me. You know, 6-8 months later, I felt a little bit dizzy, and I called you and told you, and you said come in, and we did that movement a couple times, and everything was back to normal.
Yeah.
Another question for you. You know, I find when I'm talking about it, you know, there's a perception amongst my peer group that this is an age-related issue.
Right.
And is that factual, or is dizziness, you know, independent of age? You know?
Dizziness can occur in people of all ages. So that condition, benign positional vertigo, we've had I've treated a 16-year-old who's in a motor vehicle accident, had trauma to the ear, can knock out your crystals. I've treated dancers who bend upside down. One of the most common causes of BPPV lately seem to be people who go to yoga and do a lot of downward dogs.
Oh, really?
So there seems to be a frequency of repetitive bending in some people that can cause their crystals to come out.
Right.
But there are other inner ear conditions. So if you lose your hearing, if you have acute loss of your hearing, that's a trip to emerge. Like the ENT doctors, we have a really good rapport. And if you acutely lose your hearing, that's a trip to emerge because you may have a virus in your inner ear.
Right.
And they treat that. ENT doctors can treat that. And when you get a virus in your ear, it's kind of like, I don't know if you've ever heard people have Bell's palsy or shingles. It's just a virus attacks a nerve. And the virus can attack the nerve in your inner ear. And when that happens for 3 or 5 days, you're really sick, nauseous, dizzy, can't walk, might need help walking. And you really need to get to your doctor and then to an ENT doctor to have that treated. Because if they can get that within 24, 48 hours, they can give you a steroid injection in your ear and prevent you maybe from getting complete hearing loss. So it's really important to address any kind of symptoms you get of hearing loss or dizziness.
Right.
I think what you said, is dizziness a part of aging? We see a lot of people that come in and say, oh, I'm just getting old. You know, I'm supposed to lose my balance, or I'm supposed to be dizzy. And that's not true. That is not true. If you're dizzy, there's a reason for it. And you need to get it diagnosed and assessed by someone who has the technology and the skills and expertise to help you get it sorted.
So let's just talk about the technology and treatment and stuff, because I know when you first said to me, after you said, let's go out into your clinical area, and you said to me, I'm going to put you in a harness and we're going to do some exercise. I remember saying, Kim, I don't need a harness. I mean, come on, I'm fit. I'm good about all this stuff. Yeah. And you said to me, I think you're going to want to put that harness on. And you had me do all kinds of what I considered at the time really weird exercises. In the harness, and walking on line and standing on one foot and closing eyes. And then I remember getting on that board with the chains on it. I was wobbling all over. Like, tell me about some of the equipment you have and why it's so important to, curing this inner ear issue.
So dizziness is treatable, okay? And balance issues are usually treatable. So in the clinic for treatment, what we do is we try and improve your ability to use the information from your eyes, your ears, and your body to balance. So a lot of that technology, well, first of all, we have a fall protection harness. That's the harness that you get in, right? A lot of people say, oh, you're putting a horse harness on me. But that's there as a fall prevention strategy for our clinic. And people are afraid of falling if their balance is off. So if they're afraid of falling and we put the harness on, that kind of removes a bit of that fear of falling. And then the other thing is, you can't practice falling and catching yourself, right? You can go to the gym, strengthen your muscles, you can exercise your heart, you can do some balance exercises, but you cannot practice catching yourself from a fall. So what we do is kind of a controlled practice of how to catch yourself if you're going to fall. So we'll get you on uneven surfaces, and then we will close your eyes. So all of a sudden, you usually use your vision, your inner ear, and your joints and muscles to help you balance. So all of a sudden, if I make you close your eyes or put a mask over you, you just lost 1/3 of your sensory. All that data that's coming from your vision has just been removed from you. So I'm asking you now to use your inner ear and your leg muscles and joints to try and balance on a moving surface. Then I'll ask you to do some kind of a cognitive load. We have this drinking game one of our concussion guys taught us, the buzz game. So we add a cognitive load where you have to count backwards or count up from 0 to 30, but every time you say a number, a 3 or multiple of 3, you have to say buzz. So we add a cognitive load, which kind of mimics what real life is. If you're in Walmart, there's noise, you're trying to carry things, make your way around. That's kind of the real environment. So we put you on an uneven surface. well, close your eyes. That's why I had you do all those eyes closed exercises.
They were horrible.
They were, because when you're
They
dizzy,
were.
you don't trust your ear, especially if the problem is coming from your ear.
Right.
And most people have had some experience in their life in a 3D movie, or if you stop at a traffic light and a car pulls up and you jam on the brakes because you feel like you're going backwards. So your eyes are telling you that you're moving, but your ear knows you haven't moved. Your body knows you haven't moved, but you become very visually dependent. So you trust your eyes more than you trust the rest of your body. So when you close your eyes, we get you to use the rest of your body and your inner ear. So you can upskill your brain to learn how to use your eyes, your ears, and your joint sensors a bit better. So you were on all kinds of surfaces. One, with your eyes open and closed, and then we had you do head movements.
Yeah.
And we do that a lot with
That
our
whole
hockey
thing
players.
was like,
Yeah. So people don't realize that the ear also helps control your ability to keep your eyes on the target while your head is moving. We call it gaze stability.
right.
So a lot of our concussed hockey players will say, my eyes can't keep up with the speed of my head when they're trying to receive a puck on a stick.
Right. That makes
Right?
sense.
So that's why people feel a bit blurry vision when they've had an inner ear issue. So the head movements just get that brain coordinating that reflex and strengthen up. Dancers and anybody who does spinning type exercises can really increase that strength of that reflex. So
Well,
you did a lot of that, and you did it really well
that was
too.
a lot of the rehab. I remember that. And I'd go home and practice because you gave me those exercises. I'd be standing at home doing this, trying to count to 100 and see how many times I could do it in a minute and that type. And then the other one that I found really frustrating was the hacky sack.
Right.
Throwing it from left hand to right hand, and then close your eyes and do it.
Right.
And I dropped that hacky sack 1,000 times.
Yeah.
And then I started doing it over the counter so I didn't have to bend over as many times.
Yeah.
But the funny thing was, Kim, is that, you know, as I progressed through these exercises, the more I did them, you know, first week was really difficult. Second week it got better. But I could feel that there was a gradual improvement. So it really helped me kind of commit to doing those exercises and started doing some of my own because I could feel the difference from when I first met you to 1 week, 2 weeks, and 3 weeks, you know?
Oh, exactly.
So it's a progressional
type
recovery.
It is. And people that are really sick, like if you were a person who had motion sensitivity, and I know you're not, or a person who is a migraine sufferer, or a person who has anxiety or panic attacks. If you get dizzy, you kind of lose control of your ability to orient yourself and move in space. And it doesn't take long before your body says, oh, I don't like this. And you can develop panic attacks, right? You can get really isolated because you're so afraid of these symptoms. So can't remember where I was going with that now.
Well, it's triggered a thought on mine.
Oh, the hacky sack. Let me come back to the hacky sack. So we were talking about your ability to catch, it's a juggling exercise I do. So people who come in always say, can you juggle? Because people who can juggle are very good at using their proprioception. So when their eyes are distracted, they know where their limbs are in space very quickly.
Right.
So when you juggle, they're not really looking at their hand or their hacky sack, but they can juggle. So what I had you do is close your eyes and make your brain function without using your vision. So it had to use your inner ear and it had to use your joint receptors. So you juggled that hacky sack with your eyes closed. And then, as you said, there's a progression. So make it a little bit harder for you. I have your vision out of the picture. Now I'm going to make you move your head. So now your ear is saying, uh-oh, now I'm moving right to left. So you actually had to juggle the hacky sack while moving your head. Then we put you on the BOSU because we added a physical balance challenge then. And then when you mastered all of that, then we had noisy room. So we add noise, and then we give you a cognitive load. So that's, I don't know, did I give you to do the buzz game? Did I make you do the buzz game?
No, we didn't do the buzz game.
Sure.
But we did.
Next time, next visit.
One of the things that you just said, and I seem to know a number of people that suffer from migraines. So Is that one of the issues that could be treated by dizziness? Like if I have a dozen migraines a month, which one of my buddies does, is he a candidate to explore dizziness and balance?
So migraines are really interesting. There is a condition called migraine-associated vertigo or dizziness. So people who suffer migraines, sometimes you hear them say they have a visual aura, so they see things. So you can also have migraines where you become dizzy. So if you have dizziness associated with your migraines, I think that's a reason for you to go tell your doctor that, and then maybe look at having your dizziness investigated. If it's related to the migraine, then usually migraine management is life strategies, medication, and if there's dizziness associated with it, we may be able to help with that if it's a migraine-associated dizziness. If you're dizzy, for whatever reason, say you have an inner ear condition or you have a concussion. A concussion is a great example. So if you have a concussion, it's kind of the motherboard, the brain is put out of sync, and you can develop dizziness and you can develop headaches, which are kind of two common symptoms of a concussion. So there's treatment and headache strategies, migraine strategies, and therapy that you can do to help relieve the migraine type headaches that may be secondary to a concussion. But certainly if there's dizziness associated with your migraines, that's something you should pursue.
Well, that's another question. When I was seeing guys, saw doctors in Ontario, saw them here because it happened when I was up there. I was really lucky. The neurologist that I dealt with, she suggested to me that you should go get some physio for dizziness, and that's how I got your name in the first place. But if it hadn't been for that, I would have never known how to get in touch with you, and can I just walk in off the street into your clinic and say, I'm dizzy, can you help me?
Yeah.
What's the process of getting in and getting treatment?
Yeah, that's a really good question. So in Newfoundland, there's primary access to physiotherapy. So you don't have to have a doctor's referral to see a physiotherapist. So you can phone up any physiotherapy clinic and book your appointment and get in and get seen. You only need a referral if your insurance company requires a referral. And most insurance companies will want a doctor's referral for insurance purposes. So then
is your therapy covered under insurance?
Typically? Yes. So most insurance companies will cover physiotherapy. Everybody would just look at their policy and just see how much they're covered for. Some people it's 80%, some people it's up to $500. So your own policy will tell you the amount that you're covered. And then our business can direct bill your insurance, so you don't have to pay up front. You may have a copay, but we direct bill insurance companies. So vestibular dizzy rehab is covered under physiotherapy because it's usually provided by a physiotherapist with training in vestibular rehab.
That's good to know. I got two more questions for you, and then I know you got clients that are waiting to see you. I brought a little prop along today. This is, cast. I saved it when they cut it off. And what happened is I was walking my dog and going upstairs, and he kind of lunged to go forward a little faster, and I lost my balance. I fell and hit, and I severed two tendons. So, my question is, I think that I'm reasonably fit and conscious of this type of stuff, but I wonder, how often you see patients that have had, falls, and, what can be done to try and, especially at my age, to improve your well-being so that falls become less likely, and, because I just lost my balance on the stairs, and next thing you knew, I was in for surgery.
Right, yeah. Brian, I'm so glad you brought that up. People are so, in the 80s, there was participation. People wanted to get aerobically fit. And now everybody wants to go to the gym and get strength and strong. And yoga is really popular, flexibility. But there's never been a move to proactively improve your balance. So everybody should do balance exercises. Everybody should be aware of falls and what you can do to prevent a fall. There's a lot of things you can do to change your environment to prevent a fall, like a railing on the stairs. There's all kinds of things that people can do. There's literature everywhere. There's National Fall Prevention Month in November. There's all kinds of literature on how you can fall-proof your home, make it safe. But there's a lot of things you can do to improve your balance yourself. Doing balance exercises to have strong, healthy balance is really important for everybody. In my house, my kids aren't allowed to wear Crocs. My kids aren't allowed to run on the stairs. They're not allowed to do anything to injure their eyes. You know, I don't think we think as people what I need to do to make sure I maintain my vision, make sure I don't injure my ears, and to do balance exercises. So I'm a big proponent of balance training and being aware of how you keep a healthy lifestyle, including keeping your balance good and strong. We have a couple of programs that we do as a community service. Because we had so many seniors that are on fixed incomes, they have a certain amount of insurance or they don't have insurance. So we offer what we call an iBalance class. Kind of sounds like iFly, iPhone.
Yeah,
so we call it iBalance. And a number of seniors or people in their 50s or 60s who may have had a fall or may have had an injury come in and do balance exercises to get their balance better, to get their confidence. And even the fear of falling can socially isolate you.
Sure.
So if you know some strategies to do to improve your balance, it improves your quality of life.
Yeah. Well, that's a great segue for me for my, one of my last questions is that, after going through the training with you and treatment, I noticed a big improvement. And then I thought I was all better and I stopped doing it. And then I had this fall and I thought, this isn't like, if I work more on my balance, and I didn't really realize the three components of sight, sound, and muscle tone. Yeah. But I started thinking, I got to start doing just little things. So, and this is a funny one. I know it's quirky, but every morning when I get up, I stand on one foot and put my sock on.
Right.
And when I go to the gym, I take it off that way. And when I
Fabulous.
Put my sneaker,
Fabulous.
So I do that probably 4 or 5 times, a day, change the socks and shoes and stuff, where I refuse to sit on the bed or lean against the locker. And that's my one little thing that I do every day. So that leads me into, so what are 3 or 4 real simple exercises that I can do at home without any equipment that I can work and know that I'm going to improve my balance? Because I've learned the hard way that balance really is important to the quality of life that you had, and I owe that learning to you. But what can what can I do? What can my friends do? In their home that will, help their balance and not require gym membership or special equipment or anything.
Well, I think what you're doing is a perfect example. Keep it simple and do it regularly and make it part of a functional activity that's part of your life. So I'm really keen on people just finding a corner in their house, putting a chair in front of them, and practicing standing feet together, feet in a straight line, and on one foot, eyes open, eyes closed for 30 seconds. Real easy. Stand in the corner. You got a wall on either side if you close your eyes, chair in front so you can't fall. And even if you don't do those types of things, just have practice feet together, feet in a straight line, and on one foot, eyes open, eyes closed for 30 seconds. My kids go out, my 19-year-old goes out to racquetball. He went out last night. And I said, before you start, make sure you stand on one foot, 30 seconds eyes open and 30 seconds eyes closed. Because you just wake up your balance reactions.
Right.
My daughters play soccer. I say the same thing to them. And I think I do it, you do it, obviously, and I think everybody should do some simple balance exercise, keep those balance reactions fine-tuned.
Is there any other exercises you'd recommend to do at home? Because that's really, when you were helping me through rehab, we used to do that in the corner, and I struggled with it. So I always went to a corner, had my elbows ready, because initially I fell over all the time.
And especially if you close your eyes, you want to be safe. So those are 3 real good balance exercises, and that'll get the proprioception strength. If you want to do some strengthening, sit to stand is just a real easy exercise that you can do that is a general strong strengthening exercise for your legs. So we tell all our seniors that come in, because kind of sitting is the new smoking, you know what I mean? So seniors tend to sit more than they should. So we just get them fold their arms, sit in a good position, and just sit to stand, 3 sets of 10 every day. So you do 30 sit to stands, and it really helps you move your balance. Eyes open. You know, I don't want to tell people to do it eyes closed unless I've seen them. I don't want anyone to fall. But if you're somewhere safe, you're by your couch, sit to stand 30 times a day. Will really keep your leg muscles good and strong.
So, Kim, you know, like I said a few minutes ago, I know you've got clients or patients waiting for you. So I want to say thank you very much for joining us today. And I'd like to finish with, I'd like to ask you if some of the people that watch this want to get in touch with you and you know have an assessment, how do they go about doing it?
Great. So we have a Facebook page. We have a website, just www.nlbalance.com. Google Dizziness and Balance St. John's will come up. If you don't know where we are, we're right next to Piatto's. It's funny. Everyone who calls for the last 3 years, where are you? Where are you? We're right next to Piatto's on Elizabeth Avenue. So, and just call in, come in, make an appointment, and we'll be happy to see anybody who has a dizzy and balance issue.
And I can say to anyone who's watching, Kim is absolutely amazing. She took me from not being able to walk the street or go up and downstairs to being back at the gym full time and just back to a full normal lifestyle again. So again, thank you.
You're welcome. You're welcome. Okay. Coffee's great, by the way. Thanks very much for this opportunity.